Hello, my name is Kalama, and this is my Educated Citizen portfolio of 20. So, my public issue hits on the topic of teenage pregnancy, and more specifically, the lack of education that teenagers receive when they're pregnant, whether that be in regards to laboring, delivering, what they'll need after delivery, follow up appointments, everything. Lack of comprehensive sex education in schools. Nebraska teaches a abstinence only sex education in their schools, and it's technically not even required for them to teach sex education. With a comprehensive program, it allows not just teaching them about sex, teaching them about how things happen, why things happen, and their biological and reproductive systems. Also, the lack of support that teens can face when they are pregnant. Sometimes they can be outcast, or they feel like they don't really have a lot of people who are in that realm and can really walk through the steps with them. The reason I chose this issue because I myself was a teen pregnancy. I was 19 when I was pregnant. At 21, I had my son. And so this issue just kind of really hit home for me. I felt like I wasn't properly educated before the whole process happened, and I didn't feel as if I had a lot of support. A lot of people looked very negatively upon me for being a teenage mom. Um, Throughout the program at Nebraska Methodist, we are taught to be educated citizens, and that begins with being an effective communicator. And Nebraska Methodist defines an effective communicator as critical thinking to generate, connect, and organize ideas in a written, oral, or nonverbal manner. So, my first effective communication experience was during my labor and delivery rotation. I was 2 months postpartum, just had given birth, and so this was kind of a perfect experience for me. During my experience, I did clinicals in the labor and delivery unit at Women's, and this specific experience, I was assisting a teen mother. She was 20, but 19 when she was pregnant, 20 when she was having the baby during her labor process, and she was an hour 20 of her labor, not progressing, was told she would need a C-section since baby wasn't doing that well inside. And she didn't understand. She had a lack of education on a C-section. She said she didn't really go to a lot of her prenatal appointments, and she just kind of felt like she didn't know what she was doing. And throughout that time, I learned really good verbal communication skills. I was really able to relate with her since I had just gone through the similar thing with having a C-section, and was able to educate her a little more in terms that she would understand, because when doctors throw big words at you, sometimes you don't really know and you're kind of scared to ask. I was also able to learn some nonverbal cues, so I use those nonverbal cues to kind of communicate with her. How I will apply this, I will use those skills that I learned to help either a laboring uneducated mother or just a teen who is going through pregnancy and doesn't really know what's happening, and I can use those effective communication skills to show support throughout that whole process, and even try and educate and just be an advocate for someone who has increasing anxiety about laboring and teenage pregnancy. The second effective communicator experience that I had was actually during the pediatric oncology unit that I was on at Children's Hospital for my clinicals. We were dealing with a lot of very sick children, grieving patients who they're experiencing a lot of education, but they're kind of in a poor state of mind. They're trying to uplift their child. At the same time, they're not understanding what's going on because they're so worried about their child. And what lesson I learned was how powerful education is and how powerful communication is, and making sure that you're communicating in a way that that person is understanding, because again, sometimes doctors tell us stuff, we just nod our heads and say yes, even though we don't understand. Or sometimes it's just a really quick visit with a doctor and you feel like you don't want to take their time because they're busy. And throughout this, I learned different communication techniques to ensure proper understanding. So I would go in every time a doctor would go in, and I would hear them, and I know if I was confused and I'm in this, that they had to be confused. So a doctor would leave, and I would be like, "How do you feel about that?" And just ask them some questions, communication skills to ensure that they were understanding it. And a lot of times, those parents said that they didn't understand, and they didn't want to take up the doctor's time. So through that, I learned that to make sure I am communicating something in a way that makes sense to the person that I am either educating or the person that I'm talking to. I won't use medical jargon when I'm dealing with someone who isn't medical, and I won't use big words if I'm talking to someone who's 5 or 10 to make them understand. And I'll apply this to relationships with teen mothers to ensure that I'm properly educating them and that they can properly understand what is being presented to them, and make sure that they really are understanding and that they're being educated in a level that makes sense to them and not at a higher level to where they feel confused and lost. The next part of the Nebraska Methodist Educated Citizen is being a reflective individual. And a reflective individual routinely engages in habits of inquiry that influence ways of thinking and actions. So my first reflective individual experience was actually in the OR, and I was pregnant at the time. My experience in the OR went from following a patient all the way in PACU and sit through their surgery and watch and learn. And my patient was going to have a total shoulder replacement. This was her third. Before I went in to meet my patient, I talked to the nurse, and the nurse told me that she was rude, she was standoffish, she really didn't think that she would want me in there, but I could try my best. So I tried to make the best out of the situation since we're going to be together all day, and I started talking to her. At first, it was very, very standoffish, but I slowly was able to ask her more questions and kind of get to know her and use those effective communication skills in this reflective experience. And come to find out, she was very nervous about shoulder surgery due to prior traumatic complications that she had previously experienced with her other surgeries. And what I learned through this is that even when sometimes people come off as rude and standoffish, it may be because they're anxious or nervous. And in that time and in my reflecting, I realize I do the same thing. Sometimes when I'm overwhelmed or I'm anxious or nervous, I just kind of shut down and I come off as very rude or aggressive. So I feel like I can apply this to my nursing and um, to helping teenagers who are pregnant, that sometimes they just need someone to listen and help them reflect on how they're the time. They may not understand how they're feeling, but throughout your process and communicating with them and reflecting and always asking them, like, how do you feel about this? What are your thoughts? Getting them to open up can really help them reflect and hopefully heal throughout that process. My second reflective individual experience, I was on the med-surg patient, and this was in my 462 section, and I had a quadriplegic patient who was admitted for pressure ulcers, and we got to talking, and she expressed how she missed her granddaughter, and her granddaughter was 2, and I have a son that is 2, so we kind of bonded over that, and we just talked and really reflected and shared stories on how much our family means to us, and how much we miss them when we're not with them. Her parents are her caretaker, but they're also the caretaker for her granddaughter, so she gets to see a lot. And throughout this experience and really being able to just sit with her and talk to her for a couple hours, I really learned and reflected the importance of family and how family support is, and how being family oriented can really help during your recovery. She was so determined to do anything she could, or her parents were so determined to do anything that they could to help her recover so she can be home and be with her family. And how I learned, or how I reflected to apply this for nursing and teens, is when you're a teenager and you find out you're scared, or you find out you're pregnant, you're very scared and you start to push people away who are closest to you. That was similar in my case, and helping teens be able to reflect on and even just patients that I come across can help them reflect on positive times with either their friends and their family, and kind of hopefully help decrease that pushing away aspect and able to bring them closer to a family to create positive outcomes for them or their child, and mainly to try and reflect and focus on positive things and not maybe the negative side of it. Like, yes, you're a teen, yes, you got pregnant, but also the positive and reflecting on now you're going to have a grandchild, now you're going to have a baby, and babies just bring so much joy to this world. The last part of the educated citizen for the Methodist is being a change agent. A change agent uses the disciplines of the liberal arts and sciences to analyze historical and contemporary situations and systems to develop cultural competence, lasting hope. Throughout my time there, I was able to treat people who were mentally ill or mentally disabled, schizophrenia, bipolar, depression, suicidal, kind of the whole range. And I had a very amazing encounter with a lady. She was in a wheelchair. She was a below the knee amputee. For the whole 6 weeks we were there, she was fortunately the encounter I had. I treated her with kindness, with respect. I even helped her move rooms to get a more wheelchair handicap room because no one would really listen to her. And throughout this experience, I really learned to treat people with kindness in the way that I would want to be treated if I were in this position. She came up to me at the end of our time when I was saying bye and thanking her, and she thanked me and started crying because she was like, "Thank you for treating me like I'm a normal person and I'm not someone with a crazy illness." And to me, and I learned that we really need to create safe spaces for patients to allow them to feel respected and allow them to have those positive outcomes, because when we treat people the way we would want to be treated, so many better outcomes happen than if we were negative and talked down to people. And I feel as if I can apply this to nursing as a whole, in any patient I come across, to always treat them with kindness, even if they're not being kind back. And I will ensure, like, if I come across my teens who are pregnant, to treat them with respect always and make sure that they are in a safe space and they're making sure they're feeling adequately respected, and that I'm really listening to them and making sure that I am hopefully changing their experience for the better and creating a positive and safe environment for not only them, but for their future child. And my other change agent is my diabetic patient who I had. I've had a lot of diabetic patients, but this one really stuck out to me. She was hospitalized for a surgery, and she was post-op day 2, and her glucose regulation issues were kind of all over the place. She was in the high 200s, she was close to 300s, and she refused to take insulin, would not take insulin. And everyone was just kind of letting her, and no one was really trying to figure out the why she was refusing the insulin. And throughout my 2 days with her, we kind of talked, we got to know each other, and on my last day, I just simply asked, because I felt like we had communicated enough to have that relationship, and she said she was scared. She didn't want to be sent home on insulin like her brother once did. Like, her brother was controlled at home, went in for a surgery, had to take insulin to regulate his glucose, and then came home and needed insulin all the time. And she said, it's controlled at home with metformin. Why would I want to do this and injure myself or make myself take insulin at home? And through the effective community I learned, I was able to change her outlook on insulin and change her time there. I communicated with her nurse how she was feeling, and we both went in together and educated her on why she needed insulin, and she was taking steroids that automatically increases your glucose, and it's one of those things that metformin just won't kind of cover, and you just kind of need this as a help, and we were able to educate her, and she changed her mind and took the glucose, and I found out the next week that she went home and she didn't go home on insulin, so I was really glad that it worked out. And I realized throughout this process that a little patience with your patients and proper education and really effectively communicating can really help to change your patient's view on their situation. Um, it can help decrease the anxiety and the worry, and you can really change their whole entire experience by just simply effectively communicating. That's the base for a lot of educated citizen. Um, but I'll specifically apply this to teens who are scared of being pregnant and they're feeling alone, and just making sure that not only also a lot of teens feels that they don't have any support. So making sure they're supported and well educated will really make a difference in those teens' outcomes. Um, I have learned a whole lot about effective communicating, effective individual, and being a change agent. And throughout my experiences throughout these years, I really feel confident in my abilities to fight for my patients' rights and be an advocate, and to ensure that in the best case, I'm not having a good day. That whether like physical care or health care, or turning their bad day into a good day, I feel as if to the educated citizen have really made me not a nurse yet, but made me a strong nurse, and to always, always, always be an advocate for my people. And like I said, I can bring throughout these 4 years with me into the nursing world and the teenage pregnancy world, and show teenagers that you can have positive experiences even if you're going through a negative situation, and I can make sure that I'm educating, make sure that I am supporting, and making sure that there's someone there who has their back even when they feel like no one does. Um, like I said, each experience I've encountered has really helped to shape who I will be as a nurse, and it's made me really passionate about healthcare. And I just can't wait to get out there and hopefully change someone's day, or potentially even someone's life, and just show show the world that not everything is bad in the hospital, and you can make a positive experience out of it. Just like these experiences have really changed my life. Thank you.